Before they are referred to gastroenterologist. They has normal metabolic testing, normal labs, and his EKG shows only sinus tachycardia. So based on these symptoms, what would you think is the diagnosis and what would you do next? Just kind of think about that as we go forward. And what I typically try to think about as I'm talking to my patients is really asking myself, where do I think the patient's nausea is coming from? Right? And nausea, we often think of nausea as coming from the stomach, but nausea can come from the brain or the nervous system. So if you had nausea and vomiting or something that you've eaten, you can get anticipatory nausea. So a story I like to tell is that when I was in high school, I got sick eating shrimp. And to this day, if I see shrimp, I won't eat it. But if it's mixed in, say, like daya or yam, I will eat it because I cannot see the shrimp. So that anticipatory nausea is because of the memory there. And patients with chemotherapy, when they get nausea and vomiting from chemotherapy, when they walk into the oncology office, they'll have nausea and vomiting. The vestibular system can cause nausea, so motion sickness, seasickness, that's from the vestibular system. And then drugs from the chemoreceptor trigger drugs. No matter where the nausea is coming from, it can trigger that vomiting. So when you're talking to patients, you're trying to understand, where is the nausea coming from? Is it really coming from the stomach or is it coming from something else? So beyond the symptoms, you want to understand what the goals are. Some patients have very mild symptoms, but they want to know why they're having the symptoms. And they don't necessarily need therapies. Other patients, they don't care why they have symptoms. They just want to feel better. So understanding the goals, the chronology of illness. So what was going on beforehand? So right now we're seeing a lot of nausea, vomiting, or functional dyspepsia because of COVID. These are individuals who had COVID and now all of a sudden they have GI symptoms. Other medical comorbidities, so for example, migraine headaches, asthma, they're more likely to have DGBIs. How is this impacting their quality of life? In their physical exam, through orthostatic vital signs, you can see their signs of dehydration or postural orthostatic tachycardia syndrome. If they have nystagmus, you do a neurologic exam to see maybe it's coming from the brain or central nervous system. And if you hear a bruit, maybe there's a vascular abnormality. So this detailed history and targeted physical exam can help you identify the differential diagnosis for what might be causing the symptoms. So you have the gastrointestinal symptoms, the toxin, vestibular, central nervous system, and psychogenic. So again, thinking about the differential diagnosis. So based on the symptoms, what I diagnosed Ted with was functional dyspepsia, and we talked about that yesterday, and chronic idiopathic constipation. So he was started on an amitriptyline for the functional dyspepsia, and Miralax or polyethylene glycol for the constipation. And his constipation improved, but he still had ongoing nausea and vomiting, and had these episodes every one to two times per month. So what if we now asked Ted more about his history, about the occasional nausea he's used? And what he tells me is that he used to use marijuana 1 to 2 times per month, but he's been using more anxiety, so he's been using more marijuana, and has been using it 1 to 3 times per day for the last two years. So I don't know about Vietnam, but in the U.S., almost every state has marijuana legally. So is marijuana legal or common use in Vietnam? No, it's illegal. Okay, but just because it's illegal doesn't mean is it used. So the reason it's important to know about marijuana is that the use of marijuana is increasing around the world. And these are all the side effects of cannabis that can physiologically happen out in the GI tract. So it can decrease the LES pressure and you can have reflux. It can slow down gastric emptying and cause gastric paresis. So you just want to be aware of the use of it. And there's a condition called cyclic vomiting syndrome, which is these intermittent stereotypic episodes of nausea and vomiting, which looks just like cannabinoid hyperemesis, which is nausea and vomiting that is due to chronic cannabis use. And what do we mean by what's considered chronic or what's considered too much? What's described is more than 4 times a week for a year. In addition to cannabinoid hyperemesis, there's cannabinoid withdrawal. So these are patients who are using it, or individuals who are using cannabis every day, but when they stop, they have symptoms. And so the symptoms can be very similar, but the timing for the symptoms are different. So I did do a little Google research before coming here, and Thailand and Israel are the only countries in this region where medical cannabis is legal. Recreational is still illegal throughout this region. And the problem here is that, and this was just in the news recently, is that because of the legalization of cannabis, Thailand is seeing a lot of problems, and they're seeing a lot more of cannabinoid hyperemesis. They're also seeing a lot of tourism for medical cannabis. So even though it's illegal here in Vietnam, we still want to ask, not in a judgmental way, but just to say that, are you using marijuana? It can affect your symptoms. I need to know so that I can help you. So it's not very judgmental at all. So then, once you make a diagnosis, then you want to treat based on the symptoms. And this is a nice review, more on gastric paresis, but I changed it and adapted it to put more dyspepsia symptoms. So the symptoms more abdominal predominant or nausea and vomiting predominant. And then you can look at the severity. So if the symptoms are mild, then you treat them over the counter and dietary recommendations. If they're severe, moderate to severe, then you have to escalate the therapy.